In recent times, we've witnessed an unprecedented influx of immigrants, in many cases illegal migrants, into major urban centers such as New York City, Chicago, and Los Angeles. Now, the main entrance migrants are taking into the United States are places like Texas. Eagle Pass is a particularly common location. Arizona, as well as California. Now, we've received multiple warnings from experts about a potential widespread disease outbreak as a result of this. And this migration, fueled by the search for better living conditions and the promise of more accommodating state policies, has led to a dramatic increase in the populations of these cities. Now, while the arrival of new residents brings cultural and economic vibrancy, it also strains existing infrastructures, particularly housing and healthcare systems. Now, as these cities become increasingly overcrowded, the risk of a public health emergency looms large. Now, before I explain about the hazard that this potential presents, all I ask that you guys do is do one thing. It only takes a second. Just tap the like button. I really do appreciate that, guys. Appreciate you. So the potential for contagious diseases to spread in densely populated areas, coupled with insufficient healthcare provisions for the rapidly growing immigration population, poses a serious threat to public health. Now, with the healthcare systems already currently stretched thin, the additional demand could very well overwhelm the facilities that we do have. And this could leave many without access to necessary medical care. And it goes way beyond this. So this situation, it not only endangers the health of immigrants, but it also places the entire urban population at risk. And as I dive into these different details with you guys, I want you guys to understand the crucial, complex dynamics that are at play and the current and urgent need for comprehensive solutions to prevent this full-blown health crisis from spreading. Now, I want you guys to take a look at your screens here. Migrants bust in from the border is not just an immigrant crisis. Think health crisis. Now, if we scroll down a little bit here, never mind this group of people here who are laying on the streets here. So migrants could be carrying infectious diseases. Now, this is something that we all know. And these people are camped outside of the Roosevelt Hotel in Manhattan, New York City, by the way. Now, here's the thing. Migrants could be bringing infectious diseases across our southern border. When they're bused to New York and elsewhere, these diseases go with them. A recent study showed that more than 4% of migrants from Central and South America to Europe were sick with Chagas disease. It's contagious without the help of an animal or a blood-sucking bug, and can cause serious complications, including heart failure. Now, it goes even worse than this. Tuberculosis is on the rise in this country, as is syphilis and other sexually transmitted infections. The Centers of Disease Control and Prevention reports that immigration applicants with communicable diseases are inadmissible into the United States, but they can't be stopped if they aren't routinely screened before entering the country, as is the case with undocumented migrants. In other words, illegal immigrants could be coming into the country without being tested and bringing in all sorts of who knows what with them in terms of diseases. Now, it gets even worse here. So let's see. So it looks like here a spokesperson at the Division of the Global Migration and Quarantine at the CDC said that the CDC has comprehensive systems to track communicable diseases. They do not track diseases by immigration status. But here's the thing that's a little bit alarming, to say the least. Dr. James Hodges, an internist practicing at the Texas border, said that in his experience, the open border is leading to more drug-resistant tuberculosis in the United States because patients are only partly treated by the only over-the-counter antibiotics available in Mexico. In southern Arizona, Pinal County Sheriff Mark Lamb said, Border Patrol and local agencies have seen all sorts of diseases like tuberculosis, scabies, COVID, hepatitis A and B, gonorrhea, syphilis, mumps, chickenpox, dengue fever, etc. And so this is a major concern, guys, just to say the least. Now, here's the thing, the migration patterns observed in recent times leading to overcrowded cities are largely influenced by a combination of state policies and the immigrants' pursuit for better living conditions. Now, states like Texas, they're experiencing a high influx of migrants, immigrants, and illegal immigrants as well, and have initiated policies to send these individuals to cities like New York and Chicago, where local governments have expressed their willingness to accept them. Now, this policy is intended to distribute the immigration policy or the immigrant population even more evenly across the country. Inadvertently, this is contributing to the rapid population growth in these urban centers. Now, the allure of California with its warmer climate, a lot of the migrants who ended up getting bused to New York are complaining that it's too cold there. And of course, California's generous state policies, including healthcare benefits for low income immigrants, has made it a particularly attractive destination. Starting January 1st, California expanded its healthcare coverage to include more than 700,000 immigrants living illegally in the state. This is a policy move that underscores the state's commitment to providing for its diverse population, but it also contributes to the appeal as a designation for migrants. Now, the immediate impact of this influx on city infrastructures is quite profound, to say the least, particularly concerning housing and healthcare services. Now, in urban areas already grappling with limited housing stocks, face increased pressure as the demand for incoming populations outpace the supply. Now, this imbalance is leading to overcrowded living conditions with multiple families sharing single living spaces, such as density. This type of density exacerbates the risk of spreading contagious diseases. This is a concern that is particularly acute in the context of a potential public health emergency, which we just had less than 4 years ago. Now, healthcare services are similarly strained. The surge in population, it not only increases the demand for medical care, but it also places a significant burden on public health systems that are already operating at or near capacity. Now, with the expansion of healthcare coverage in states like California, there's a clear intent to address these needs. However, the sheer volume of new residents, it really challenges the system's ability to provide timely and effective care. But this scenario, the risks not only the health and the well-being of the immigrant population, but also the broader community's health. And essentially, resources are stretched beyond what they can handle, what they can manage, whether it's routine healthcare needs or even the potential outbreaks of disease. The resultant population growth, it places considerable strain on the city infrastructures, particularly housing and healthcare services, creating a scenario where a risk of a public health emergency becomes an ever-present concern. Now, the dramatic population increase in cities due to the influx of immigrants, it could significantly strain public health systems, leading to various challenges in managing public health efficiency. Now, the strain is multifaceted, impacting not just the ability of healthcare services, but also the quality and the accessibility of care for both immigrants and the existing population. Now, experts warn that one of the most pressing concerns is the rapid population growth in the densely populated areas is the heightened risk of contagious diseases. In environments where people who live in close quarters, diseases can spread more easily. And the situation is exacerbated when access to healthcare is limited. Immigrants, particularly those without legal status, may face barriers to accessing healthcare services, including fear of deportation, lack of insurance, and of course, an unfamiliarity with the healthcare system in and of itself. Now, this limited access can delay the diagnosis and treatment of potentially contagious diseases. This is increasing the risk of outbreaks that could also affect the wider community. Now, the strain on the public healthcare system is further compounded by specific challenges, such as the lack of medical personnel, resources, facilities to accommodate the growing population. And many urban healthcare systems, they were already under pressure before the recent influx, dealing with staffing shortages, limited bed capacity, and stretched resources as it was. So the additional demand for medical services can lead to even longer wait times, reduced patient care quality, and increased stress on healthcare workers, particularly leading to burnout and further exacerbating the staffing shortages. Now, the infrastructure of healthcare systems, including laboratories, outpatient clinics, public health departments, they might not be equipped to handle such a sudden increase in demand for services. And this can hinder the effective disease surveillance, vaccination campaigns, and of course, public health interventions that are essential for preventing the spread of contagious diseases. Now, experts emphasize the need to have proactive measures in order to mitigate these risks, including expanding healthcare services, increasing funding for public health infrastructure, and of course, implementing policies to ensure that immigrants have access to necessary healthcare services without fear of repercussions. Additionally, there's a call for more comprehensive healthcare strategies that consider the unique challenges that are posed by newly densely populated urban areas. Now, this dramatic population increase in cities, it can literally severely strain these public health care systems beyond what they can support. Now, the potential spread of diseases from overcrowded cities due to the influx of immigrants can significantly impact various states across the country, especially those that are directly connected by major transportation routes. We're talking buses, trains, or those offering appealing living conditions and job opportunities. Now, the states most at risk include not just those with major urban centers experiencing this initial influx, such as New York, California, and Illinois, but also their neighbors and states along these key migration paths. So look at New York, right? New York as a primary entry point and destination for migrants, the risk of disease spread within the state, it's quite high. But it also poses a risk to neighboring states as well, as people move in search of work and more affordable living condition. Then you got California, known for its very welcoming policies and benefits of immigrants, including healthcare. California's dense urban centers could be a starting point for the disease to spread to other parts of the West Coast and inland. Then, of course, we got Illinois. With Chicago being a major hub for immigrants, the potential for disease spread from these central locations to surrounding states is very significant. And of course, you got neighboring states at risk. You got New Jersey and Connecticut, very close to New York. These states could see an influx of people moving across state lines, bringing with them the potential for spreading diseases. You got Nevada and Arizona. Neighboring California, these states could experience increased migration from individuals seeking jobs, maybe warmer climates, posing a risk of disease transmission. Then we've got Wisconsin, Indiana, and Missouri. Neighboring Illinois, these states could be impacted by people who are moving from Chicago, searching for employment or maybe less crowded living conditions. And of course, you got states along key migration paths. You got Texas as a major entry point for immigrants coming into the southern border. Texas not only faces its own challenges with population density and public health, but it also acts as a conduit for migration further inland and towards other states. Colorado, Utah, well, these states could also see an increase in population as immigrants move further inland from both Texas and California, seeking employment opportunities and less crowded living conditions, right? And of course, you've got Oregon and Washington. As a part of the West Coast, these states could be destinations for immigrants moving from California, bringing with them the potential for disease spread. So the spread of diseases could occur through various channels, including the movement of people via major highways, bus routes, trains, flights connecting to these states. So additionally, the interconnectedness of the economy kind of means that, as people seek employment, as people seek benefits, they move to states with significant agricultural, manufacturing, or even service related industry jobs, further increasing the potential for interstate disease transmission. Now, given these dynamics, it is crucial for public health officials across these states to collaborate very closely, sharing information and resources to effectively monitor and respond to any kind of emerging health threats. This may actually involve coordinated disease surveillance, public health messaging to ensure vaccination and hygiene practices, and prepared decision making on when to implement measures like travel restrictions, maybe quarantine requirements. Addressing the root causes of overcrowding and enhancing the public health infrastructure in all states will be key to mitigating the risk and the spread of diseases and protecting the health of all residents, both the new and established. Now, think about this, guys. Mumbai, India, they're known for its very dense population. Mumbai has faced significant public health challenges, including outbreaks of diseases such as tuberculosis and COVID-19. The city slums, where overcrowding is a severe issue, has been particularly vulnerable. Now, the lesson from Mumbai is that the critical importance of improving living conditions and healthcare access in densely populated areas to prevent disease spread. So basically, in the face of all the challenges presented by the recent unprecedented influx of immigrants into major urban centers such as New York, Chicago, Los Angeles, and through key points like Texas, Arizona, and California, our communities and governments at all levels are called to action. And so this migration, driven by the human quest for better living conditions and of course the allure for accommodating state policies, it definitely enriches our cities with cultural diversity and economic vitality if it is done legally. However, it simultaneously imposes significant strains on our infrastructure, notably in housing, healthcare, and ultimately setting the stage for potential public health crises that could ripple across the nation. So basically, the scenario that we're confronted with is not just a test of our resources, but a test of our resilience, our innovation, and humanity. So I hope that you guys take heed of these warnings and you share this video with someone who needs to hear it, because these are real and legitimate issues that we could very well be facing right here at home on U.S. soil. So I really do appreciate you guys for tuning in. Thanks for hitting the like button. Thank you for subscribing to the channel. And I'm going to see you guys on the next one. Y'all take care.